Hey everyone, good evening to the June 6th version of Kidney Disease Editorial Edition with Kenneth Sorenson. Tonight we're going to have I think, an interesting show. Please bear with me. I'm kind of been under the weather the last few days, and also I'm going to be reading a lot because there's a lot of statistics and I can't remember all of them. But I want to start out tonight. Let's start out by recognizing the people living and dead that landed on Normandy Beach 75 years ago today. These men risked, and a lot of them lost their lives to correct a wrong against humanity. I will never be able to express my gratitude for them enough, and we will always be indebted to them. And so I definitely want to recognize those people. Just like last time I was on, we talked about Memorial Day. D-Day was an incredible achievement militarily, but most importantly, saving lives. We lost a lot, but I believe we saved a lot too. Um, Tonight, our topic is going to be about health insurance in the United States. We will cover my health insurance story, the Affordable Care Act a little bit, um, the major healthcare companies or health insurance companies, and maybe what we might be able to do to kind of correct this. I'm going to try not to be political, so please look beyond what might be the problem politically and more about what the solution might be. So let me tell you a little bit about my story. You all know about my transplant, my kidney disease story, but let's talk just a little bit about kind of my health insurance journey. Most of my professional career, I was in the hospitality industry, particularly the hotel industry. That's an industry that's notorious for not paying well, and it's also notorious for having horrible benefits. And I can definitely attest to that. I worked in the hotel industry for about 13 years, and I was a manager of one of the best ones in the country that's located here in the Charleston area. Um, and that was before the Affordable Care Act happened, so please keep that in mind. Um, I'm a single guy, and I paid about $800 a month for insurance, and I also had a $2,500 deductible. And I was thinking I was making about $34,000 a year, which obviously isn't much. My copays were around $50 a visit, and yet again, hospitality industry, horrible benefits. And it just so happened I liked the company, so that's why I stuck around. And it's kind of what I was trained to do. I started working in hotels when I was in college, when I was 19 years old. I think and I stopped working when I got too sick to work. That too sick to work didn't mean I was on dialysis. I when I stopped working, I believe my GFR was around 22%, and I think it needs to be on around 20% in order to start dialysis. So I was kind of in limbo. I didn't have any insurance, and I still needed to see doctors. My nephrologist talked his practice into not charging me while I was out of work and not receiving disability or having Medicare. He also kind of acted as my primary care doctor because I couldn't afford to go see one of those. Um, I called the ACA hotline to get insurance through them because a family member offered to pay for it. So when I called them, they quoted me a price of $450 a month, which isn't crazy considering what I was paying when I was working. But um, when you have no job, that's tough. And that 450 a month was for the lowest form of insurance they had. Um, and I go to a lot of appointments, so that's not necessarily going to work out too much. I asked the agent because I was curious, why was it so expensive if I had literally earned no money? And she said that they incentivize people with tax credits, which because I didn't file taxes because I wasn't making anything, then that those tax credits wouldn't help me. The other uh, thing I had to realize is that this was just going to be a tough journey for insurance. I did a lot of research, and it was going to be a tough journey for insurance. Luckily, a couple months later, or not luckily, but it worked out where I was able to get on Medicare because I got to the 20% GFR. I probably started dialysis before I really needed to. because that was the best way to get me insurance. And so the other thing that we did was I started on PD, so I could almost start dialysis immediately. Medicare starts, as I talked about in the last show. Medicare starts when you start dialysis, and the kidney is the only organ in the body that has universal health care, luckily to President Nixon in 1973. Uh, so, uh, Medicare is a very good insurance, as those of you know that have it, but it covers only 80% of the costs, which means there's still a lot of leftover costs. I'm still waiting to see the final tally on my transplant, but I think it's going to be pretty high in the end. But at least I had insurance then. I could see doctors, that kind of thing. And when you're going through chronic kidney disease, in addition to that, I have diabetic retinopathy in my eyes, particularly my right eye. In addition to that, I have a severe case of gastroparesis. Um, high blood pressure, diabetes, all those things. Um, and so I needed insurance and able to get the care I needed. About 5 months after I started dialysis, I got disability, which was awesome. It wasn't that much money, but it's at least a little bit money. And it actually, and I didn't get it because of my kidney disease. I got it because of other issues. And luckily, that also meant that I would have Medicare because of that too. So I was definitely solid when it came to Medicare. I think it even will eventually cover me after my 3-year post transplant goes through. So I think, luckily, I think I have that going for me. Um, and uh, and so next thing I want to talk a little bit about is the Affordable Care Act. I was lucky enough to have a member of my family, one of my, or actually my cousin's husband. He was one of the people tasked with writing the Affordable Care Act. He works with a lot of major hospitals, and so he was one of the people that were talking about it. And this is when I was, kind of getting sick, and so I was visiting him in his where he was living, and we were going out to dinner, and he told me on the drive there that the Affordable Care Act wasn't the final solution. It was just part of the solution that Obama wanted in order to get health care for everyone. And when we talk about the tenets of it a little bit in a few minutes, you'll see that one of the things he was pushing with it, or the people that were writing it was pushing, was particularly preventive health care. They figured that in the end, if they could get people to prevent diseases, then in the end it would actually save the government money, which I agree with. The amount of money spent on uninsured people going to emergency rooms and things like that would be severely reduced if we had some sort of preventive health plan. Right now, people that aren't insured use the emergency room as their doctor. That's the only option they have. Emergency rooms can't, or at least the ones I know of around where I live, they can't ask you about insurance until after they've treated you, which obviously is good for them, but um, um, it's not good for the taxpayers, but it's the only option those folks have. I can tell you, housekeepers at hotels, for instance, they don't make enough to afford insurance. I remember having to get medicine for a housekeeper because she couldn't afford it, and it was for a heart problem, but there's no way she could afford it, and so it was me helping her, or her basically, dying from this heart condition. So the Affordable Care Act then it made it easier for people that were lower income to gain health insurance. Uh, the basic goal of the ACA was to extend Medicaid to low income families and to provide government subsidies to other Americans that are below 400% of the poverty line. The poverty line in 2015 was, for a single person, it was 11,770, and for a family of four, it was 24,250. And that's two parents and two kids. Um, I was kind of shocked to think that that was the poverty line. I can't imagine, a single person living off of, basically $24,300 a month, or for a year, let alone a family of four. But those are the, kind of the census gathered poverty lines. the number of uninsured citizens in was 44 million. I actually think it was a little bit higher than that, and that was in 2013, which is the year before the ACA was adopted. In 2016, the number went to 27 million. Um, by 2017, the number had jumped back up to 700,000. That is mostly because of the attempt to dismantle the ACA. Here's a little bit more about the ACA. The law attempts to accomplish the um, the above things I talked about through a number of regulations, taxes, tax breaks, mandates, and subsidies. For example, regulations that stop insurers from denying coverage to those with pre-existing conditions, which that's another major cause for me, because at this point, if there wasn't the ACA, the ability for me to get health insurance, and most of us that are listening to get health insurance, would be very, very small. So that's definitely a good thing. It provided subsidies of health insurance premiums and out-of-pocket costs. The mandate for large employers to provide full-time employees health insurance, which is another major thing. I think it was any company that had more than 50 employees had to then provide some sort of healthcare option for its employees. And taxes on those who profit due to the expansion of healthcare, like drug companies. Eventually, I'm going to do a show on drug companies and their profits and things like that. But think about that. That was basically punitively uh, attempting to lower drug costs and lower the profits of those companies that are kind of being ridiculous with what they're charging because they can. They're the only game in town. It's a really big racket. There's I saw a 60-minute special the other day about or a few weeks ago about how companies are actually colluding with each other to force prices up. They're saying in this market, I'll let you be in charge. You can charge whatever you want in this market. I'll charge whatever I want, that kind of thing. And there's actually proof the federal government is actually going after drug companies for these kind of things. Um, Total, there's over 1,000 provisions in Obamacare, or I'm sorry, the Affordable Care Act. So keep in mind, I just kind of gave the basics, but those are kind of the basics of it. Uh, the Medicaid expansion hit a major snag when the following states, and actually it's gone down, but these are the ones that are currently not accepting the federal aid to expand Medicare in states. Wyoming, South Dakota, Wisconsin, Texas, Oklahoma, Missouri, Kansas, Mississippi, Alabama, Tennessee, North Carolina, South Carolina, Georgia, and Florida. Um, to tell a personal anecdote, when I did get disability, I tried to get Medicaid, and so I went to the Medicaid office, and I found out that I made $33 a month too much to make Medicaid to earn Medicaid. Part of the reason is because my state is one of the states that refused to accept the federal money to expand Medicaid. I can't really think of a good reason why they've decided that, but I think it was more out of political reasons. Most of these states are, let's say, differ politically than what Obama was, and so that's the only reason I can say they would not want more federal money to help its people. Um, and if you look at the countries provided, most of these states have some of the poorest healthcare levels and the highest levels of uninsured people, and it's not a coincidence. There's a reason these states have a tendency to be lower level. If you rank the best states to live in, these are kind of the lower level ones, um, and there's a big reason behind that. It's because they have a tendency to not support people that need it the most. They have a tendency to try to they have that saying that people should pick themselves up by their bootstraps, and I'll be one of the first to admit, if you talked to me 10 years ago, I probably would have said the same thing. But now that I've lived and learned, I see that sometimes people really do need help, and you really can't group everyone into one category. You kind of have to help people. They definitely need it. But these states are the ones that have decided to not accept that help. Um, So let's talk a little bit about insurance companies for a second. The three largest ones are Healthcare Service Group, or it's the same thing as United Health. You also have Anthem and you have Humana. Between those three companies, they comprise about 30% of the people that are insured through health insurance. Um, Healthcare Services Corp is about 12%. Anthem is about 9%, and Humana is about 7%. Let's talk some dollars because that's ultimately what kind of matters. Is Healthcare Services Corp. Uh, Annual revenue is about $184.8 billion a year. Anthem is at about 89.1 billion, and Humana is at 23.1 billion. Uh, and let's also look at a little bit of uh, something about the compensation of these CEOs. The statistics I found were from 2014, so obviously that was 5 years ago. So things could change. But United Health Services, their CEO was Stephen Hensley. He made $66.1 million a year, which comes out to about 254,328 per day. Um, Anthem's CEO, Joseph Swedish, made about $8.1 million per year. That's $31,016 per day. And finally, Humana's CEO, Bruce Broussard, made about 13.1 million a year, which is 50,319 per day. Think about that. Every single one of them per day earns what more than the poverty line for a family of four would make. Stephen Hensley, the first one, $254,328 a day is incredible. And I'm not one of those people that don't think that people that are CEO of large companies like these should be making, a small amount of money. They provide a lot to their companies, and so I understand why they make good money. But I don't think it's very reasonable as to what they actually make. I don't like the idea of counting people's money, but I just I don't know. We've talked about this before. I just think that there's some businesses that profit shouldn't be the main focus. Helping people and saving lives should be the main focus. I'm going to give you an example. I was talking to one of my friends today, and she lives in South Carolina, and so obviously that's a state I'm familiar with, and and this is one of the big reasons I'm passionate about this subject. Um, she's about 35 years old. She has two kids, and she works for one of the largest hospitality companies there is. Um, she also has United Healthcare through her employer. She pays a little over $600 a paycheck, so over $1,200 a month for insurance for her and her. She has two sons. Her deductible is $1,500, and she pays 25 to see a general doctor and 50 to see a specialist. With insurance, one of her youngest son's medicines is $200 a month. She is one healthcare problem away from being bankrupt. She works her tail off about 70 to 80 hours a week and lives paycheck to paycheck. Um, I know I say this a lot, but we live in the richest country in the world. But why are people dying because they can't afford healthcare? My friend doesn't deserve to work so hard and be one health emergency from living on the streets. Um, I I've really thought about this a lot through my journey, and I'm super passionate about kidney disease and helping people with kidney disease and helping people with transplants. But I think I've kind of grown to realize that that we need just as much help in this arena too. I completely believe that the United States has one of the better healthcare systems in the world. Um, we definitely have great doctors. I mean, at one point, the Prime Minister of Canada, before the current one, had heart issues, and he went to Detroit to get to have his heart, operation. So obviously, we have great physicians. We have great, people from all over the world. I think my surgeon for my transplant was originally from India. So people from all over the world want to work in the United States. And part of the reason is because doctors can make decent money, and healthcare professionals can make good money. Um, but but I do think that there has to be some sort of kind of conscious consciousness to the industry. They take the Hippocratic oath, and basically they take an oath to help people. And so I just think that sometimes the idea of getting profit has just gotten out of hand. And I mean, I think car companies can charge what they want because it's a good that's not a necessity. But I think places like food companies and medical companies, those are kind of things that people need to live. And if they need to live, if they needed to live, then there should be some sort of cap. I know I'm from the South, and we get hurricanes, fairly regularly. We haven't had a major one here in Charleston since 1989. We've had a few smaller ones, but they actually have a cap on gas prices during that time. Because their point is, when supply and demand becomes such a problem, then the gas stations would be more than willing to gouge people because, well, they can, because people need that gas to get out of here, or even just save gas for surviving the days when we don't have gas. And I don't understand why we could put something like that on gas, but we can't have stuff like that on healthcare and food. And I'm not talking about McDonald's. I'm talking about healthy food. It's interesting to me that some caps are okay, but others are not. And so I thought about a lot while I was sick, especially when I ran into that situation when I didn't have insurance and I called the ACA hotline, and that's what I encountered. Um, and basically, if I made $100 a month, I could have basically gotten healthcare for free. Uh, but since I wasn't making $100 a month, then I couldn't get anything. So um, I thought about it a lot, and I think that as part of my kidney disease crusade, I also want to try to become more of an advocate for people with health insurance. I had a friend whose brother was diagnosed with epilepsy, and he lost his job because of it, and I offered to go down to the Medicaid office with him because you know um, uh, I know more about it than he does, so it'd be easier for me to help him than it would be to for him to go down by himself. And he, it's probably intimidating to him and things like that. And I definitely understand that, because when you're dealing with government things, it can be pretty complicated. And like if you're applying for disability, for instance, most people are denied a few times. Luckily, I wasn't, but it's a difficult process in order to just get the help you need, even if it is, government assisted. It's tough just to get the help you need. So one of the things I'm going to do throughout this show, every so often, is I'm going to talk about healthcare, the healthcare insurance industry. I'm going to talk about healthcare in general in the country, because I think that that's that's where we need to head. Like, I think the Affordable Care Act was a great idea, and I think, as my cousin said, it was a great first step. Unfortunately, we're going through a point in time where those helps for people are being dismantled. And to be honest, I don't really I've never really fully grasped the other side of the aisle, or the other side to why we shouldn't have it. I understand it costs money, but so does paying for people that are uninsured to go to these hospitals. It's extremely expensive. So how would you rather spend it, with them having insurance, or them just basically getting it for free? I'm not an advocate of necessarily no one paying anything. I think that you can't necessarily give healthcare away for free. I mean, there's obviously a couple forms of how to pay for it. If you look at some of the European countries and even Canada that has universal health care, taxes are higher. I know everyone in the United States hates taxes being higher, but I've always said they seem to be okay with it when it comes to schools and roads, but they're not okay when it comes to health insurance. You could raise, I think there's one candidate for president that said that, I mean, you could basically raise taxes by 1% and pay for the majority of healthcare. Um, Also, they could have kind of the Medicare model, where the Medicare model is you pay a flat rate. I think I pay $145 a month or something like that. I think it kind of varies. I've heard different figures from different people, but you could have the Medicare model where everyone pays X number amount a month, and if everyone in the United States is paying that, then the buying power that the U.S. government can have will be tremendous. We talked last week about how the reason why dialysis clinics are allowed to charge so much is because they know they're going to get paid, and that's the thing about the federal government is the federal government basically pays its bills. Obviously they kind of nickel and dime a little bit, and I'm sure doctors' offices and hospitals are kind of annoyed by that. But in the end, they get money off of it, and places like DeVito or Fresenius have become experts on how to bill where they get the most money out of it. I think and I can't say I'm well versed enough to be able to give you the answer because the amount of money involved in it is far above my pay grade. But the Congressional Budget Office and things like that did the work before Affordable Care Act and came up with the fact that this would be a at least a good start of a system um, in order to get the ball rolling on healthcare for everyone. People are really scared of the term universal healthcare, and I think that's just semantics. It basically comes down to making sure everyone in this country has access to affordable healthcare, and as I said, around probably 28, 29 million at this point do not have that. And I don't know, I know this is the urban outreach, poor communities. I mean, they're ravaged with dialysis clinics, and one of the reasons is because the people don't have health insurance. There's also a little bit of fear of going to doctors and things like that. But yet again, if we're working on preventive, then they're not seeing doctors because they're sick. They're seeing doctors to figure out how to not be sick. And if a lot of those families, I know in my healthcare, in my dialysis clinic, even, which isn't necessarily an urban one, probably half the people in there, if they had access to affordable healthcare, particularly diabetes drugs, insulin is really expensive without insurance. If they had access to education about health, those kind of things, then these places would be a lot smaller in numbers. Steve is big on talking about nutrition. That's something they just touch base with, I think, in schools. If that's something we had as part of our plan to educate people on eating properly and the reasons we do it. If we had yearly physicals for everyone, the detection of kidney disease and things like that would eventually kind of would happen faster, and so we could react to getting it at the early stages, like stage one, as opposed to I found out, I think I was in stage four when I found out. So there's a lot of different things we can do to try to curb the different diseases we're having in this country, particularly kidney disease. Yet again, we mentioned it last time. Kidney disease is the ninth leading cause of death in the next 10 years. I can actually foresee it maybe jumping into the top five because diabetes and hypertension aren't getting any better. So, but that's kind of my take on health insurance in this country. I have a lot of other thoughts on it, but this is a great start. Yet again, please send us any messages if you have any more thoughts that I missed that you'd like to see me address and research and things like that. My email address is Ken Soren, so KenSoren at AOL.com. Also, I want to let you know that thank you for listening tonight. Next week, have Steve, and he's going to talk with me about dialysis and health insurance from his perspective. He knows a lot about it and has some firsthand knowledge. And I want to make sure you guys have a great night, and I'll see you next Thursday. And this time it's going to be at 8 p.m. instead of 8:30. We'll be on at our normal time, which is going to start being 8 o'clock. Anyway, have a great night, and I look forward to seeing you guys next week. Bye.